Introduce yourself with your name and role. State your full name and your role. For example, my name is Dr. Tariq Zahid Khan and I am ENT surgeon. Explain the procedure in simple terms, emphasizing that you will be gently feeling for any lumps or swelling in their neck. Explaining that this is a routine part of a physical examination and it is important for assessing their health. Now you will confirm patient's identity, confirm the patient's name and date of birth to ensure you have the correct individual. After the explanation, ask for patient's consent to proceed with the palpation. If the patient is hesitant or has any question, address them before proceeding. You will use simple language, explain that you will be gently feeling for any lumps or swellings in their neck. Emphasize that this is a routine part of the examination and it is important for assessing their health. You can gently explain that some patients may experience slight discomfort during palpation, but it should not be painful. Now you will obtain the consent of the patient. After explaining the procedure, ask the patient if they consent to the neck node palpation. If the patient has any question or concerns, address them calmly and provide further clarification. If the patient consents, proceeds with the examination. To effectively expose if you find anything suspicious, document your findings, note the location, size, tenderness, and mobility of any enlarged or suspicious nodes. How you will prepare the patient for neck node palpation. Explain the procedure to the patient and ensure that they are comfortable, preferably sitting upright with their neck relaxed. To effectively palpate neck lymph nodes, both the doctor and patient need to be positioned comfortably. The patient should be seated upright, ideally with their head slightly tilted towards to relax neck muscles. The doctor will stand behind the patient to access the neck from all angles. Patient would be upright and he should be sitting with their back supported. The head should be tilted slightly downwards to relax the neck muscles and make palpation easier. Hands should be relaxed in the lap. The doctor's position would be behind the patient. This allows for palpation of all areas of the neck. Utilize finger pads. The pads of the fingers are used for palpation to better feel the texture and characteristics of the lymph nodes. Explanation and consent. The doctor should explain the procedure to the patient, including the areas to be palpated, and obtain consent before starting. The doctor should systematically palpate the different regions of the neck, including submental, submandibular, preauricular, anterior cervical, supraclavicular, posterior cervical, postauricular, and occipital areas. The doctor should compare the sites. Palpation should be performed bilaterally to compare for symmetry and any abnormalities. The doctor should observe the neck for any visible swelling or skin changes and palpate for tenderness, size, consistency, and mobility of the lymph nodes. Use the pads of your index, middle, and ring fingers to palpate the neck, applying gentle pressure. Move your fingertips in a circular motion, feeling for any lump or bumps. Pay attention to the size, shape, consistency, whether it is soft or firm, and mobility of any palpable nodes, and You will compare both sides of the neck for symmetry. Note any swelling, tenderness, or unusual characteristics of the lymph nodes. Normal lymph nodes are typically small, mobile, and non-tender. Swollen or enlarged lymph nodes may indicate an infection, inflammation, or other medical condition. If you find any enlarged or abnormal nodes, note their location, size, and any associated symptoms. To palpate submental lymph nodes, gently press your fingertips under the chin, behind the bony prominence of the jaw, and use a circular motion to feel for any swelling or tenderness. Submental nodes are located in the midline of the floor of the mouth, just behind the mandibular symphysis. For the palpation of submandibular lymph nodes, which are located in the submandibular triangle of the neck, which is below the mandible, between the anterior and posterior bellies of the digastric muscle, locate the area below the mandible, that is jawbone, slightly in front of the angle of the jaw. Use a gentle circular motion with your fingertips to feel for any enlargement or tenderness, carefully rolling the tissue beneath the mandible. It is helpful to have the patient tilt their head slightly forward and to the opposite side to relax the muscles in the area. For the palpation of preauricular lymph nodes, the patient should be in a comfortable position, either sitting or standing with their neck relaxed. Use the pads of your index and middle fingers to gently palpate the area in front of the ear. Apply gentle circular pressure, moving your fingers in a small rotating motion. Palpate both sides of the face simultaneously to compare and identify any differences in size, texture, or tenderness. Be aware that the parotid gland is located in the same area and may be confused with lymph nodes, but it is typically larger and more superficial. Palpate post-auricular, also called posterior auricular lymph nodes. For that, you will have to stand behind the patient and use the pads of your fingers to gently feel for them behind the ear. Superficial to mastoid process. For the palpation of deep cervical lymph nodes, the position of the patient would be sitting upright and ask them to slightly flex their neck forward to relax the muscles. Stand behind the patient and use the pads of your fingers to gently roll the tissues along the carotid arteries and behind the clavicles. Compare both sides for any differences in size, consistency, or mobility. Have the patient sit with their neck relaxed and chin slightly lowered to aid palpation. Position yourself behind the patient to allow for easier access and comparison of both sides. Deep cervical lymph nodes are located along the carotid arteries and behind the clavicles. You will be palpating these areas specifically. Use the pads of your fingers, second, third, and fourth finger, and gently press and roll the tissues over the muscles in these areas. Avoid pressing too hard, which can make it difficult to assess the nodes. With your thumb, you can push the posterior part of any lymphatic swelling anteriorly, and with the pulp of your index and other fingers, the anterior portion of the lymph nodes. Note any abnormalities in size, shape, consistency, for example, firm or soft, and mobility, whether the nodes move freely or are fixed. Palpate both sides of the neck simultaneously to allow for comparison of any asymmetry. Normally, deep cervical nodes are not palpable, but they can become enlarged and palpable with various conditions. Communicate with patient. Ask the patient if they feel any pain or tenderness during palpation. In addition to the carotid and supraclavicular areas, you may also want to assess the posterior cervical chain along the trapezius muscle. To palpate cervical lymph nodes level 2, 3 and 4, stand behind the patient and use the pads of your fingers to gently press and roll the skin over the areas where these nodes are located. Start with level 2, that is upper jugular nodes, then move to level 3, middle jugular nodes, and finally to level 4, that is lower jugular nodes. Compare both sides for any differences in size, shape, or consistency. For level 2, that is upper jugular, locate the area along the internal jugular vein just below the angle of mandible and extending down to the level of hyoid bone. Use the finger pads of 2 to 3 fingers to gently palpate the area, rolling the skin and underlying tissues under your fingertips. For level 3, that is middle jugular lymph nodes, move your fingers down the middle third of sternocleidomastoid muscle, palpate along the internal jugular vein, again using gentle pressure and a rolling motion to assess for nodes. Pay attention to any enlarged or abnormal nodes. For level 4, that is lower jugular group of lymph nodes, continue moving your fingers down the sternocleidomastoid muscle to the lower third near the clavicle. Palpate the area along the internal jugular vein, checking for any palpable nodes. Compare the findings with the other side of the neck. Use light to moderate pressure during palpation to avoid pushing the nodes too deeply or causing discomfort. Use a circular or rolling motion with your fingertips to effectively palpate the nodes. Always compare both sides of the neck nodes to identify any asymmetry or differences. Inform the patient that you will be palpating their neck and ask them to let you know if they experience any pain or tenderness. To palpate level 5, cervical lymph nodes, locate the posterior triangle of the neck, posterior to the sternocleidomastoid muscle. Use the pads of your fingers to gently press and roll the tissues, moving in a circular motion along the posterior border of sternocleidomastoid muscle towards the trapezius muscle and the supraclavicular area. Level 5 includes the spinal accessory chain and transverse cervical chain. Now palpate level 6 cervical lymph nodes. The patient should be positioned sitting upright and their head slightly flexed forward and relaxed. Palpate the anterior compartment of the neck, including the paratracheal and delphian nodes by using the pads of your finger and applying gentle pressure in a circular motion. Compare both sides for any asymmetry in size, consistency, or mobility. Level 6 nodes are located in the anterior compartment of the neck, specifically the paratracheal and delphian nodes, which are situated medial to level 3 and level 4. They are found along the trachea and larynx. Use the pads of your fingers, usually the second, third and fourth fingers. Apply gentle circular pressure, rolling the skin and tissue over the underlying structure. Avoid pressing too hard, which could make the nodes feel larger than they are. Start by palpating the anterior neck, moving from submental area down along the trachea. Pay attention to the area around the thyroid and larynx. Palpate both sides of the neck simultaneously to compare for any differences in size, shape, consistency, or mobility. Be sure to note any enlarged, tender, or fixed nodes. Inform the patient that you will be palpating their neck and ask them to let you know if they feel any pain or tenderness during the examination. For supraclavicular lymph nodes, the patient should relax their shoulder and potentially tilt their head towards the opposite side to improve access to the area. Place your fingers above the clavicle, slightly behind it, and use firm circular motion to feel for any enlarged nodes. Have the patient relax their shoulders and potentially tilt their head towards the opposite side to make the area more accessible. Use the pads of your index and middle fingers, or sometimes 3 fingers, to gently palpate the area above the clavicle just behind it. Gently press into the area and move your fingers in small circular motions to feel for any nodules or swellings. Pressing, as this can make it difficult to feel small or subtle changes in the nodes. Move your fingers systematically across the area, covering all possible locations where supraclavicular nodes might be found. Compare the findings on both sides of the neck to identify any asymmetry or differences in size or consistency. If any enlarged nodes are found, pay attention to their size, consistency, whether they are soft, firm, or rubbery, tenderness, and mobility, whether they are fixed to the surrounding tissues or mobile. Some practitioners prefer to use both hands simultaneously, one on each side of the neck, to facilitate comparison and better assess symmetry. Be aware that pain or tenderness upon palpation could indicate inflammation or other issues. Virchow's node. The left supraclavicular node is also known as Virchow's node, and it is particularly important and can indicate metastatic disease from abdominal or thoracic cancers. After palpating a patient's neck for lymph nodes, a simple and polite way to express gratitude is "Thank you for your time and cooperation during the examination." You can also add, "I appreciate you allowing me to assess your neck." This conveys appreciation for their participation and patience during the physical examination. Here is a more detailed breakdown. A straightforward "thank you" is perfectly acceptable. Add specificity. Mentioning their time and cooperation makes the thank you more meaningful. Acknowledge their role by saying, "Allowing me to assess your neck." You acknowledge their active participation in the process. If the palpation caused any discomfort, you can add, "I hope it wasn't too uncomfortable." This shows empathy and consideration. Optional addition that you can also add, "Do you have any question or are you comfortable?" to ensure they are okay and have any concern addressed. After completing the neck examination and palpation of the neck nodes, you will re-drap the patient.